We are here for the Northeast Region Community Health Needs Assessment Roadshow. And go to the next slide. Looking at our agenda today. You all know me, but you're going to meet me again. We're going to go over the Community Health Needs Assessment overview, as well as the survey results, and then addressing the priorities that were identified through this, and then have a little bit of discussion. So if there's any questions while we go through this, please direct them to Pearl Gore, who is one of the hosts, so that we can address those at the end. And our objectives, we're going to give you an idea about what the process for the CHNA is, as well as the impact that it has on our region, identifying the CHNA findings specific to the region and the cities and towns, as well as accessing and sharing NCDPH community health data that can be used in programming, policies, and grant writing. And then Annie is going to talk a little bit about participating in addressing the CHNA priorities through Maricopa County's Community Health Improvement Plan, which is called the CHIP. And then we're going to talk a little bit about the upcoming cycle. I know it seems like we just finished, but the 2026 cycle is right around the corner. So next slide. Okay, so I think I already said it. We're going to send those questions into the Zoom chat and address them to Pearl. We'll have Q&A at the end. We'll also have an evaluation survey. If you could complete that at the end, we'd really like your feedback. It's always helpful, and it directs, our direction and how we want to go forward. There will also be a recording of this and the slides, and we will share those in 3 to 4 weeks following the presentation. Next slide. So, like I said, I think most of you know me. I've been with Maricopa County Department of Public Health as a public health liaison for the Northeast region since January 2024. I'm an MSW from Arizona State, go Devils. I was a child and family therapist for 9 years with Jewish Family and Children's Services. And I was also a health educator at the University of Arizona for 10 years. So a little bit about what the Northeast region looks like. It's comprised of cities and towns. We've got Cave Creek, Carefree, Fountain Hills, Paradise Valley, and Scottsdale. So we go from the small to the biggest. And so next we're going to talk a little bit about the CHNA overview, about the process and impact, and then the findings specific to the region and cities and towns. We're going to watch this video. So it's the video that was used to promote the 2023 CHNA data collection efforts. And it provides an overview of why we do the CHNA and why participation is really important. And we consider this to be a part of our call to community leaders of 1.5 years ago to support the process. So go ahead and start that video.
What does health look like in your community? Join us as we explore the health and well-being of residents of Maricopa County for our upcoming Community Health Needs Assessment Survey, launching in March 2023. Maricopa County Department of Public Health strives to create a healthy, thriving Maricopa County for all by listening to what's important to the community and engaging people in meaningful ways. To do this, we collaborate with healthcare systems and community partners to conduct a Community Health Needs Assessment, also known as the CHNA, every 3 years. By working with community partners, we have increased the level of resident input we collect over the last 10 years. When more residents reflecting the diversity of Maricopa County take the survey, we better identify and address the issues that people in our community care the most about. What has CHNA data shown us so far? For the last CHNA, we conducted 2 community surveys, one standard survey in 2019 and a supplemental survey in 2021 about the impacts of the COVID-19 pandemic. Across these two surveys, the community identified the following priority areas. These top priority areas also emerged in stories shared by the community. Here's one story shared by a community member regarding their physical and mental health impact. So where does this data go after it's collected? The CHNA data has sparked action to accomplish the following. Share data with at least 7 major hospitals and healthcare providers to inform new approaches to serve the community. Center community voices to inform decision-making for program and policy development. Direct funding to local community organizations to address top community needs such as mental health, access to care, and social determinants of health. And inform the CHIP developed by over 100 community partners who form the Health Improvement Partnership with Maricopa County. The CHIP is a long-term systemic effort to address health needs based on results from the CHNA. What else can promote well-being and health equity? We look to community members to tell us in the upcoming CHNA launching in March 2023. As a leader in Maricopa County, your partnership is key to that success. Our collective efforts to promote survey among our networks, both virtually and in person, will help ensure that we capture the most representative. We hope that our collaboration will provide strong opportunities for Maricopa County residents to achieve lifelong health. Visit maricopahealthmatters.org to explore past survey results, complete the CHNA interest form, and become a CHNA champion today.
Okay, so with the support of many community partners and through community events, we were able to obtain and collect 18,000 surveys. So this was the highest number of representative responses to date. So you can see we were able to reach almost 1,000 veterans, over 1,300 with those living with disabilities, over 2,100 of those identifying as LGBTQIA+, and then over 1,600 refugee, immigrant, and migrants. And you'll see in Northeast, we had 1,670 surveys completed. Next slide, there we go. And so in order to have city profile specific to your city or town, there was a criteria of having at least 250 responses from city residents. So you'll see in the 2021 cities and towns, in the Northeast region, we had Cave Creek and Scottsdale had a city profile. And in 2023, we added Fountain Hills. They were able to get over 250, as well as Scottsdale again. And unfortunately, Cave Creek dropped off, but we have hopes of getting them back on the next go around. So next slide. So here you can see the survey participants that are broken down by region and then by city. So you can see in the Northeast, Cave Creek had 148, Paradise Valley 49, Fort McDowell 25, and Carefree had 22. And again, the cutoff was 250, as I said before. So here we had participants come together and we partnered with a lot of different community organizations, workforce, health collaboratives, community centers, public school health systems. So we really partnered with a lot of different organizations so that we could get the best overall thorough surveys done. So these were some of our keys to success, really meeting where the communities were at. So a lot of community events. I wasn't here during this time, but I know that the public health liaisons were out in the community a lot on the weekends and evenings, really trying to get those surveys, and the cities and towns providing a lot of support and inviting them, engaging local community organizations from various sectors, and then mobilizing. We had public health staff volunteers and students to collect data through events and tabling. And here you can see a breakdown. We collected data for 18 weeks. There was a set amount of time, a limitation of how long we could collect that data. 68 staff and volunteers through 187 community events, over 1,300 hours at these events. And there were 4,500 giveaway kits. So we had a little bit of funding to give some different giveaway kits as incentives for people. And so now I'm going to hand it over to Annie, our specialist, to give those that data and CHNA survey results.
Hi, everyone. Nice to be with you today. My name is Annie Damude. I'm the Community Health Assessment and Impact Supervisor here at Public Health. So in this role, I help manage the data collection and organization and distribution efforts of the Community Health Needs Assessment, as well as manage our hospital healthcare partnership called the Synapse Coalition. So they use a lot of these results to help inform the work that they do, meeting the needs of the community. So we're so excited that these results are something that are able to be used in multiple sectors, in healthcare, for our community organizations, for our cities and towns. And so we're really glad that you're here today and curious about what we found from the community. So in this section, the objective is to equip participants to access and share community health data for use in programming, policies, and grant writing. To give a little background about data collection over the years, we conducted our first community health needs assessment in 2012 and reached almost 1,000 surveys. If you remember from a few slides ago, in this last cycle, we collected almost 1,000 surveys of veterans alone. So we've really grown a lot in the last, the last 11, 12 years of data collection. And some of that is through being able to build out better data collection infrastructure. Over the years, we were able to add mini grants for outreach for community organizations, added the survey in a virtual format, used a regional approach to recruit participants, and then added additional languages. So in the most recent 2023 survey, we had the survey available in paper and virtual format in 13 different languages. We also had members of our CARES line who they take phone calls and help direct community to resources, able to offer the community verbally for folks who'd rather take it over the phone. And so we've seen that number grow to now we had 18,000 responses at our most recent data collection. So when we do a community health needs assessment process, the survey is actually only one part of it. That is the data we're going to focus on today. And with the community survey allows us to get the most amount of information from across the county. But there's a couple other ways that we collect input from residents to go a little more in depth. So for example, we hosted over 40 focus groups with specific populations during this cycle. For example, we had youth focus groups, LGBTQ, refugee, immigrant, migrant, etc. And these were conversations, an 1.5-hour long conversations where people were able to kind of express their experiences, their perceptions, how we can improve health. And then key informant interviews were conducted with over 20 community leaders across sectors. So we had healthcare, education, municipalities, etc. And both of these reports are available online at maricopahealthmatters.org. And so we definitely encourage you, if you're curious to see kind of those in-depth quotes and ideas that came from the community in that longer format, check out those reports. But today we're going to focus a little bit more on the survey. So before we dive into results, I want to make sure that we're all feeling comfortable with how to interpret this data. So the format that you're going to see in these slides, as well as on the profiles, as if you have access to those. For example, I'll put in the chat the Northeast region results. If you click that, you're going to see a 3-page profile that is, you can follow along with what we're going through today. They'll have a similar format. So at the top, it explains of the profile, it explains how many people in that region or city took the survey. And then we look at some of the main questions. So here's an example of one of the questions we asked. We asked participants, how would you rate your physical health? Good, fair, poor? And then when we look at the results, we see 8% of overall, that category is referring to the percent of all respondents who reported poor physical health. So when you go through the data, you're going to see both on the all respondents from the county at large or all respondents from that region. That's the percent overall who reported poor physical health. Well, one of the benefits of us collecting so much representative data from different communities and demographics is that we like to take a look at how do different populations have different health outcomes and experiences. So for people who took the survey, we asked them to also identify their race, ethnicity, age, gender, income, as well as if they were belong to a focused population, for example, senior living in a care facility, refugee, immigrant, migrant, etc. So as you can imagine, there's lots of different options for each of those categories. So what we did is for every question, we looked across the board and we said, okay, for these genders, for these age groups, what percentage of people in those age groups, what percentage of seniors, what percentage of women identified that they had poor physical health? And then we took the groups that had the highest rates of self-reported poor physical health, and those make it into the top 3 that you see in the profile. So we do have data across the board on all of the different demographics. We have a big data report that is also on the website. So if you love tables, you can take a look and see how everybody stacked up. But we really want to highlight those that showed kind of the greatest need or the greatest health issue. So what's another way to look at this data? We could say over 1 in 4 disabled respondents and 1 in 5 unhoused respondents reported poor physical health compared to 1 in 12 overall respondents. And a possible interpretation may be disabled and unhoused respondents report the highest rates of poor health and may benefit from additional support and resources. So hopefully this helps kind of set the stage. If you have any questions, again, I'd like to direct you to the chat. You'll be able to, should be able to chat to myself, Pearl, or Krista. Please send any questions you have to Pearl. And we'll kind of crack on to discuss the data. So there's a link in the overall chat, and you can also scan this QR code for reports. The data we're showing today, again, is all available online, but we really wanted to put that in context for you. So we look at the Northeast regional participants. There was 1,670 people who took the survey that lived in the Northeast region. The 2 different cities that had that cutoff of over 250 responses to get a featured profile include Fountain Hills and Scottsdale. So when we're going through some of these results, I will be calling out if Fountain Hill or Scottsdale respondents had some different data than the Northeast and the county level regions. We look here, it's kind of a population comparison. I do want to say that this cycle, we collected the most comprehensive demographic data that we ever have. So we had several additional race and ethnicity categories. For example, Middle Eastern North African was a race ethnicity option. We had Hispanic Latino provided as a racial category embedded in instead of separate from race ethnicity. And then we also had more opportunity for folks to self-identify if they had multiple race ethnicities. If they had to choose one, would they choose to be multiracial, or was there a certain race group? All right, I see a hand up. I am now wondering, do folks have access to the chat feature? Let me double check a setting real quick. All right, I think I just enabled chat. Kira, do you mind popping your question into chat?
I don't think I see the chat. Oh, here it is.
Thank you. All right, so then as we look at age, we have those under 18, 65 plus, male, female. So we have a lot more categories. Okay, perfect. Thank you. Yes, so sorry about that. Feel free to add any questions you have to that chat, and we will do our best to get to them. basically the categories that we show here are ones that we have national measures for, so US Census, etc. So I do want to say that the data we collected was even more detailed, but the ones that we showed here to be able to compare to census are a little bit more pared down. So just wanted to kind of create that note. For example, here though, of the population, according to the US Census, living in the Northeast region, 2% of residents identify as American Indian or Alaska Native, that's in the light blue. And then 4% of people who took the survey identify as American Indian or Alaska Native. So when we look at this, we had a slightly higher percentage of folks who identify as Native American, Asian, Black, or African American who took the survey than you would expect based on the underlying population. And why that is because we had a really a very intentional outreach strategy to ensure that we got to hear from these populations and these voices that often have too few numbers for us to be able to publish data on. And so just wanted to kind of explain that seeing those numbers be higher means that we were actually able to break down that data that we haven't been able to in the past. So it's really exciting. All right, so our first survey question: which health issues have the most impact on you and or the people you live with or care for? So when we compare Maricopa County to the Northeast region, there was the same 5 top health issues. You'll see they're in slightly different orders, but for Northeast region, we had high blood pressure, anxiety, chronic pain, depression, and diabetes. Again, the rank's a little different than Maricopa County, which had anxiety ranked #1. But then when we look at comparing these kind of top issues to our specific cities, Fountain Hills ranked heart disease and autoimmune disease in their top 5 health issues, and Scottsdale ranked chronic stress in the top 5 health issues. There was about 20 health issues to choose from, and there was write-in options, but these are the ones that really rose up to the top. And again, if you're curious to see how some of these other health issues, whether it's, cancers or injury, how those ranked, you can head over to that overall report and see what percentage was identified there. The next question: how would you rate these assets in your community? We asked people to rate probably a list of like 20 different community assets as very good, fair, poor. And what we did here is we pulled the ones that were ranked, the top ones that ranked as poor. So the lowest ranked community assets. So we had both the county and the Northeast region identify access to affordable housing, access to quality public transportation, and ability to communicate with local leadership and feel my voice is heard. Those were the lowest 3 rated assets. Fountain Hills in the lowest rated assets included access to substance use treatment services. Here's where we have a slight difference between the county and the Northeast region. When we asked folks, when we looked at the top rated assets, both Northeast and Maricopa County had access to parks and green spaces, and then opportunity to participate in religious, spiritual, or cultural events. But whereas countywide, folks included feeling safe in your home, a top asset for the Northeast region was access to public libraries, community centers, and educational events. And then Scottsdale indicated 2 additional top assets, which was access to safe walking or biking paths and access to safe spaces to exercise and be physically active. Another thing to note is countywide, the very best rated assets was only about in the 50%. So about 50% of respondents identified that, the top assets were very good. Whereas we see in the Northeast region, we have 80 and high 70s, reflecting that these are very good assets. So you kind of see a difference there too as well, and how high these community assets are ranked. So we asked, how would you rate your physical health? And this is another question where you might recognize this from the example. We compared the responses from all the different demographic groups. So again, there's probably 40 different measures when we're looking at all the different race, ethnicity groups, age, and gender groups. And then the ones we're identifying here are the ones that had kind of like rose to the top. So top rated of poor physical health, top rated poor mental health. I will say that these do differ by cities because there are quite a few sub options. So I didn't do any call outs if the cities had a different sub option, but we'll direct you to your Fountain Hills and Scottsdale profiles. I do also want to mention too, I apologize if I didn't mention this earlier, while Fountain Hills and Scottsdale were the only two cities that we can call out specifically for data from those respondents, anybody who lives in the Northeast region who took the survey is counted in the Northeast region data, as well as the Maricopa County data. So don't worry if you're not seeing your Northeast city as one of those featured profiles. Anyone who took that survey is still counted in the Northeast region, still counted in Maricopa County. So countywide, the top three categories for poor physical health included disabled, unhoused, and income less than 15K, fairly similar for Northeast region, disabled, unhoused, but in this case, income 25K to 35K. And again, we do see a smaller, about half the percentage of folks that rated poor physical health compared to overall county. Mental health, we do see kind of similar ranges, 10% of overall county residents reported poor mental health, 7% of Northeast residents reported poor mental health. Similar groups included age 12 to 18 and unhoused, but the Northeast region also had the age category 19 to 24 as one of the top groups that rated poor mental health. We asked how often could you get medical care when needed? Sometimes, and these are the groups that responded sometimes or never. So at the county level, there was 36% of people overall. So like 1 in 3% of folks had difficulty getting medical care. For Northeast region, 1 in 4 individuals had issues getting medical care. And the subpopulations really differed. So for the Northeast region, disabled, age 19 to 24, and Hispanic Latinx folks had the highest rates of difficulty getting medical care compared to the county. And then the same question was asked about mental health care. How often can you get that when needed? So 46% of Northeast region participants indicated difficulty getting mental health care, so quite a bit higher than medical care. And the top groups included those with disabilities, Hispanic Latinx, and age 19 to 24. So we're seeing some trends in that Hispanic Latinx, age 19 to 24, with some access issues to care. And again, I encourage you to look at your individual city profiles to see if the subpopulations are the same or they might be a little bit different. And so you can kind of target some of your approaches accordingly. Fortunately, we didn't just ask what the problems are, we asked folks for solutions. So we said, what would help you get the care you need? And we asked this to everybody. So not just folks who said that they struggled to get care, but even those who said that they usually get care when needed. Because we know that there's barriers that can help anybody get access to care if addressed. So Northeast region mirrored Maricopa County with the top 3, which were more appointments available, having lower out-of-pocket costs for services, and having evening or weekend appointments. But folks in Fountain Hills, one of the top 3 assets that would help them get care was services closer to where I live. So that's the last of the survey data we're going to be going over. I want to kind of put it out there just to see if these results are resonating with kind of like what you see in your communities, if there's anything that was surprising. So feel free to think on that. You're welcome to put it in the chat. Again, love to hear any questions through the chat. But I also know that a lot of you're focused on work on substance use. And so we wanted to provide a little bit of story-based data. One at the county level through our youth focus groups. And then we have a few quotes at the Northeast region level from the survey. So here's a couple of different quotes. I know it's a lot of text, so I'll try to summarize. From our low-income youth focus group, they talked about not having as many therapists available, lack of education, and just kind of that lack of attention to the youth, and that is kind of creating that turn into using substances. For the Native American focus group, was talking about kind of some issues with identity and using drugs, and again, not kind of having folks pay attention to some of like the real needs that individuals have. And then another member of a youth focus group basically identified the substance use issues in schools, and that it would be helpful if this was looked at as something to address with resources instead of just addressed with punishments. So those are a couple different perspectives from our youth. When we look at the Northeast region, we did have for our survey, we had an open-ended question at the end, which was anything else you'd like to share about your health or the health of your community. And of the 18,000 people who took the survey, 4,000 people wrote in that final comment. So we're in the process of doing an analysis. In the spring, we'll be releasing more information about that. But we wanted to pull a couple quotes as a sneak peek that related to your cities and to substance use. So from Fountain Hills, we had a quote, "There are frequent articles in the Fountain Hills Times about drug and alcohol addiction, how terrible it is, how rampant it is in our community, but no one wants any rehabilitation centers anywhere near the town. Even though those centers are part of the solution, it's frustrating, and for my own mental health, I have to take a step back from these community discussions." A quote from Cave Creek, "I personally do not have many issues with my healthcare, but my daughter, who's 40, is living with me now. She's struggling with addiction, finding help and affordable living." And then from Scottsdale, "We need more mental health facilities and drug treatment centers." All right, so on that cliffhanger, going to plug again where you can find these resources. So you can go to maricopahealthmatters.org to download the survey profiles. Again, we have profiles for the regions and for the cities that hit 250. We also are going to be in the next few weeks publishing a couple additional profiles for focus populations. So those will be coming soon as well. We have these big reports. So if you want to look at the focus group report, key informant interview report, they're big, but there's a lot of fantastic information. This community survey report is like 70 pages, and it includes every single question broken down by different demographics. So that is a great place to look if you're curious across the board, what did those age 12 to 18 have to say about a certain topic? We also have great resources with population data, seeing how health outcomes have changed over time. And in the next couple of weeks, we're going to be publishing a CHNA dashboard. So it's going to be pulling together all these different sources and helping to tell the community story. So this is going to really be an asset to not only hopefully to help inform you and your work, but to share with your organizations and communities. If you're looking through this data and you're having trouble finding something, or you're like, I think I'd like more specific population data on this, you're welcome to submit a data request. Those will go to our epidemiology team, and they will be able to let you know if that data is available and perhaps fulfill that request. And then we always welcome connecting with us. Maricopa Health Matters at maricopa.gov. My team manages that email, and we're happy to set up a time to talk with you if you want to go over results in more detail or talk about what this could mean for your communities. But something that's really important is that after, we had a lot of effort and a lot of community members and organizations really put their time in to get this data, we're not just going to identify the issues and then leave, right? We want to move on to address these overall CHNA priorities. And so I'm going to give two invitations to you all today. One is to participate in addressing priorities through the Community Health Improvement Plan, or the CHIP. And the next is to support the upcoming 2026 CHA cycle. As Krista said, feels like we just barely finished this last one. 2026 is around the corner, and we hope to maintain the momentum that we've had this cycle. Hopefully seeing some of this data and getting to explore it is helpful for you. And if you're looking and you want to see your city on the map next time, we want to figure out ways that we can partner to get that data. So what's happening with the CHIP? Every 3 years, we complete an improvement plan to respond to the needs we've identified through the CHNA. It's a requirement for public health accreditation. It really helps us set priorities, targeting resources, define coordinated actions by community members to promote health. We went through about a 6-month process where we looked at all of those different data sources: survey, focus group, population data. We took the data in front of committees the Synapse Healthcare Committee, the Health Improvement Partnership of Maricopa County. Maybe some of you sat in on some of those meetings to really narrow down the focus areas to include mental health, access to healthcare, access to healthy food, substance use, and housing homelessness. These are huge topics. How are we going to address them? What's the approach going to be? Well, fortunately, there's opportunities right now to be having those discussions. And I mean, literally in 20 minutes. We have been having a series of community conversations to really hone in on these priorities and what we want to focus on, what angle of mental health, what angle of housing homelessness. So we had one virtual subcommittee meeting October 9th. There's another one happening today from 12 to 2 p.m. We know it's a last minute invitation, but if somehow you have a little free time in your day, you want to grab your lunch and join in, these are virtual conversations around the different priority areas. And if today's a little bit too short notice, join us on November 20th. You can scan these QR codes to register. Pearl also has the links in the chat. And if you come to a virtual meeting, you're not necessarily committed to helping address these issues for the next 3 years. We're really helping to kind of set the course for what are some goals that we want to focus on. And then we'd love to invite you to the December 4th quarterly partner meeting that is open to HIPMC members, but then in general members of the community. It's always a good time. We have networking opportunities, food, presentations, and we'll be able to hear what these subcommittees have come up with for focus areas for these priorities. So if you want to hear more about the Community Health Improvement Plan, you can visit hipmc.org, contact the team, and just register for the newsletter. So there's a link to register for that. The newsletter is a really great one-stop shop. There's always links to upcoming meetings, photos, recaps of what was discussed before, sometimes profiles from different or little snapshots from different organizations. So really encourage you to check it out if you are interested. All right, with that, I'm going to pass it back to Krista to help field some questions.
Thanks, Annie. That was a lot of information, and I appreciate you putting that all together. I could have never summarized it as well as you, so I really appreciate it. Okay, so are there any questions looking in the chat? I saw Pearl kind of posted one, but I can't see it. Can you see it, Annie?
Yes, I think there's a question. Is this CHA considered 2023 or 2024? So I can speak to that. It is considered, I'm sorry, let me double check. The data was collected in 2023, and the way that we're naming, there's been so much discussion of how we're naming the different cycle years. I want to make sure I nail this. So the cycle, so we collected data in 2023, and the cycle is the 24 through 26 community health needs assessment. And then we'll collect data in 26 for the 27, 20 through 29 needs assessment. So great question. The reason we keep referring to it as the 2023 CHA is because that was the year we collected data. But I know it's a little confusing. So thank you for that clarification request.
Any other questions? Let's see, how do I reach out to find out about how my organization can be involved in data collection for the next CHNA survey? So I think that we're starting to ramp up, some planning about how we're going to roll out the next CHNA, and so we have some planning meetings coming up. So I'm not sure, Jessica, who did that question come from? Essentially, I would just say reach out to me. I'm your public health liaison, and so we can kind of strategize the best way to try and get your city or town to get a profile, or to maintain your profile to keep it up for the next cycle. So that's what I would say. Just reach out to me.
And we typically have a bunch of tools and resources that we start advertising to like our community organizations in advance of the trial launch. So that video we saw was a resource we made for data collection 2023. We'll probably do something similar for 26. We have toolkits, so lots of like photos and QR codes, and if you want to virtually brand or co-brand with the county, for example, this city is is a partner in data collection. And so, yeah, like Krista said, she's going to be your best point of contact for those opportunities. But we love this question because, again, we would not be able to have such rich data without partnerships like y'all's. I see another question here. Scottsdale is doing a strategic plan, and I'd love to incorporate this data in our evaluation. Is that appropriate and okay for me to reference the survey?
Annie?
I would say absolutely. That is a fantastic application of this data. This data is for the community. And so I would say, anything like, this video will come out and the recording and the slides will come out in a couple of weeks, but all these links have the data. So check out the website. If you are, needing a little bit help navigating through it, reach out to Krista, or reach out to Maricopa Health Matters at maricopa.gov, and we can set up some time to meet with you. But yes, we absolutely encourage using it for, evaluations, grant applications, etc. We ask that you, provide a citation as the Maricopa County CHNA, but we can even work with you on just some language for that. But yes, this is also a very exciting question because this data only really matters if folks are using it. So thank you for that.
So I think, Annie, maybe what I'll do is when I send a follow-up email after this, maybe can I include that slide? Is that appropriate? Or should I just sub it out so that they can have that information in case they missed it?
Like the different links?
Yeah, the different links
yes.
that you have on that slide.
Absolutely. Yes, we will. We'd love to make sure that these links, because I know sometimes when you leave the meeting, the links are gone. So you can include that in the email.
Okay, great. Any other questions? Okay, well, we appreciate your time, and we'd appreciate a few more minutes if you could fill out the evaluation to help us improve our presentations in the future. Would be great. So once you're done with that, like I said, I will follow up with an email, make sure everyone has the appropriate links if you'd like to access some of that data prior to the recording and this PowerPoint that's going to be available in the next about 3 weeks.
I don't think we're seeing any other questions come in. So yeah, thank you for taking some time with that. It's a very short evaluation, but helps us as we have been doing these for each of the regions to improve. With that, Krista, are we good?
Yeah.
Close it out?
Yeah, we're good to close it out. Thank you, everyone,
Thank you
for coming.